The declaration of pecuniary interest. If not, declare it now if you do. And we have two information items that this morning. The first one, post-traumatic stress disorder, and that information is attached.
Yes.
Charlie, would you like to make some comments about that
Yes, thank
program?
you very much, Mr. Chair. I do have the two information items, the first one being the post-traumatic stress disorder, which you all have received a copy. I did want to just highlight some of the background in this, and as is reported to you, in April of 2016, the province of Ontario passed the supporting Ontario's First Responders Act, and this new legislation created the presumption that if post-traumatic stress disorder is diagnosed in first responders, then that diagnosis is automatically considered work-related. This presumption allows for faster access to the WSIB benefits, resources, and timely treatment. Also, due to this legislation, the Ministry of Labour requires that all employers of workers covered under the PTSD presumption to submit a PTSD prevention plan. Bruce County Paramedic Services have developed the attached draft plan that you have, and will be submitting that plan to the Ministry of Labour prior to the April 23rd deadline. Chief Ray Lux is here with me today to answer any questions on the report, because I really would not be able to respond to details.
Okay, thank you, Charlie. Are there any questions from council?
Through you, Mr.
Yes,
Chair,
Kelly?
I wonder if the chief could be asked to make some overriding comments in terms of how the plan was developed and the work that was done for the benefit of the committee.
Okay.
Okay, I should get that out of the way.
Yeah, there we go.
Thank you. So yes, it was about a year ago that there was this new legislation was passed, and we were required to come up with a plan. We, as an organization, I think we're fairly early in developing this. I know there's a lot of other groups that are still working on it. Hence, part of the documentation that we want to keep living, and we may need to change a few things based on how some other services are doing things. But as part of this, there was a template provided by a group that works with the Ministry of Labour, so we've based it on that. Eleanor McEwen was fundamental in getting a lot of this work done for us, so we really do appreciate her help. And we kind of had a bit of a cross-functional group to work on the plan in consultation with us and with some of the health and wellness people through HR, and worked on this. And through this, we'll eventually turn it into a whole county workplace mental health plan as well. But what it does is outline how the county needs to respond to post-traumatic stress disorder, how we can maybe prevent some of these things, and outline some of the training that will happen with some of our staff and supervisory staff, and ultimately even the senior management team, as to how we can work through a lot of these issues that could possibly happen. What we have to consider it basically as a occupational health and safety hazard, the way that we understand it, so it's got to be reported the same way that so that WSIB recognizes it. It just makes this process a little bit easier for staff should they actually get diagnosed by a psychiatrist or a psychologist with PTSD, that they will get WSIB benefits a lot quicker than what used to happen in the past. So.
Good, thanks, Ray. Any other questions? If not, thank you,
Okay,
for the work that you did on it. It's important that it's in place. Moving on then to item B, the 2016 call statistics.
It's been distributed to you, through you, Mr. Chair. It's been distributed to each member of the committee that the 2016 paramedic call statistics have been distributed, and it's noted that in 2016 there were 10,944 calls handled by paramedic services, and in comparison to 2015, the total call volumes for the entire county have increased by 3.5%, and since 2011 it's 5.7%, so that is quite substantial, I feel. And Chief Ray Lux is here with me to make comment or certainly to answer any of your questions on the report that he has compiled for us today.
Okay, do we have any questions for Ray? Any comments, Ray?
No, I do know that you, this answers kind of by month, the number of calls that we've been doing over the last year. We are still analyzing, even by hour of day. There's a lot of data to go through, so we'll bring a further report later. We are trying to address the number of call and this call increase volume, and with the resources that we have, trying to see how maybe we can redistribute or work things a little bit better, especially on those busy times. So we'll come back with another report when we have some ideas of how we can maybe work on our deployment plan a little bit better to address call response times and things. Okay?
Thank you. That brings us to the end of our agenda. I need a motion to adjourn. Moved by Mitch, seconded by Ann. All in favor? Carried.
Thank you very much, Mr.
Thank you.
Chair and committee members.